Comparative analysis of IT audit cases across countries. First case focuses on Malaysia's Employees Provident Fund, or EPF, which manages retirement savings for millions of Malaysian workers. The system allows members to access their accounts and manage withdrawals digitally. In 2021, during the iSigner withdrawal program introduced during the COVID-19 pandemic, concerns emerged about security and possible personal data exposure within the platform. Because the program allowed a large number of users to access the system at the same time, questions were raised about whether the digital infrastructure and security controls were strong enough to handle the increased demand. Several underlying factors contributed to this issue. First, the platform had weaknesses in its access control mechanisms, which increased the risk that sensitive information could be accessed improperly. Second, the rapid deployment and expansion of digital services meant that the IT risk assessment process was not always thorough enough before new features were implemented. In addition, there was limited continuous IT auditing and monitoring, which meant that potential security issues might not be detected quickly. Finally, the broader digital expansion of government services also increased the exposure to cybersecurity threats, making stronger governance and monitoring even more important. In response, security upgrades were introduced to improve system protection, including enhanced monitoring and stronger authentication controls. The organization also worked with national cybersecurity agencies to review the Remedial platform and ensure that security standards were improved. From an IT audit perspective, this case highlights several important lessons. Strong IT governance is essential for digital public services. Continuous IT auditing and monitoring are necessary to detect issues early, and cybersecurity must remain a priority when organizations expand their digital platforms. The second case examines the ransomware cyber attack on Ireland's Health Service Executive, or HSE. In May 2021, the HSE experienced one of the most significant cyber attacks using Canty ransomware. Attackers gained access through phishing email and remained inside the network for around 8 weeks before deploying ransomware. The attack began earlier than initially detected. On the 18th of March 2021, a user opened a phishing email attachment containing a malicious Excel file. This infected a workstation known as Patient 0. From that point, attackers remained inside the HSE network for nearly 8 weeks. During this time, they escalated privileges, accessed servers, moved laterally across systems, and exfiltrated data. On the 14th of May 2021, the attackers deployed Conti ransomware across the network. The HSE immediately shut down its national healthcare IT systems and disconnected the national network from the internet to contain the attack. This decision protected systems, but caused severe disruptions. Many healthcare staff had to revert to pen and paper processes to continue patient care. Furthermore, the HSE activated a national crisis response. Government agencies, cybersecurity specialists, and law enforcement were involved in the investigation and recovery process. A central crisis coordination center was established to manage communication and recovery activities. About a week after the attack, the attackers released a decryption key that helped restore encrypted data. But rebuilding and restoring the full IT infrastructure still took several months. By September 2021, most systems and applications had been recovered. The post-incident IT audit identified several serious weaknesses in the HSE's cybersecurity environment. One major issue was the lack of strong governance and clear leadership over cybersecurity risks, meaning there was no single authority ensuring that risks were consistently managed. Another key problem was the limited monitoring capability. The organization did not have effective security monitoring systems or processes that could detect suspicious activity early. Because of this, attackers were able to remain inside the network for weeks without triggering a full investigation. The structure of the IT network also made the situation worse. The healthcare network was largely flat and poorly segmented, which allowed attackers to move laterally across systems once they gained access. The review concluded that the HSE required major structural changes. This included stronger cybersecurity leadership, improved governance structures, better monitoring and detection capabilities, and long-term investment in modernizing the IT infrastructure to make the healthcare system more resilient to future cyber attacks. When we compare two cases, we see two different types of IT audit risks. The Malaysia case focuses on security weaknesses in a digital financial service platform, mainly related to access control and system governance. The Ireland case shows what happens when a cyber attack affects critical infrastructure and disrupts essential national services. Together, these cases demonstrate why strong IT governance, continuous monitoring, and effective incident response planning are essential for modern organizations. Thank you for your attention.